If you're 65 or older, you may want to listen up. The annual enrollment period for Medicare is coming, and if you miss deadlines, delay enrollment, or choose the wrong plan, it may cost you money and access to the type of care that you want. Carle Timms, community broker and partner liaison for Health Alliance, joins us today to explain what we need to know to make the best choices for our health and wellness being this time of the year. Welcome to the show.
Thank you, Claudia.
So I have so many questions related to this topic, but first, tell everyone, what is Medicare?
Medicare is a federally insured program for health insurance for people 65 and older or those who are disabled.
Okay, and then let's start with the basics. Like, what does a person need to know about picking a plan?
Well, the most important thing to know is that it's an individual choice. So what your neighbor loves and works beautifully for them may not work for you. So you want to look at, where do you want to get your health care? Where do you want to live so that you stay in the area? And what medicines you take. So those are the three biggies.
Okay, and then backtracking just a little, when did you find or discover your interest in working within this field?
Well, I have been an insurance broker for a while, and then I just had worked with Health Alliance in other capacities, and when this position came open, it's the best ever. I get to go be nice to people and help people understand something confusing.
Yes, for sure. Okay, so now let's talk a little bit more about the enrollment period. When is that period, and what do people need to know?
Well, they need to know that every year they can make changes to their plan if their health changes or if they're just not happy with it. The enrollment period started Tuesday on the 15th of October, and it goes through December 7th. So between now and then, you want to look at the plan that you currently have, make sure that it works for you, find out what changes are going to be made to that plan, and then look at your options.
Okay, the way you say it, you make it sound so easy and simple. What can Health Alliance do to assist people with making it easy and simple? Because it can be intimidating to some.
Sure. What they can do is give us a call, go to our connections office, and just be sure to have a list of your medicines and the dosages. And so then we can run those medicines through our formulary, and we'll ask questions about your health. I mean, for instance, do you get a lot of CT or MRI scans? If you do, then certain plans are better for you than others. If you have health concerns, tell us what those are so that we can get our care coordination team helping you. So there's just a lot of discussion, and it's personal, like I said before. It really is up to each individual what's going to work best for them.
And then I also hear there's some changes coming this time around for the enrollment period. What are those changes that's happening?
Well, there are changes and there are things staying the same. So first of all, things staying the same. We still have our zero premium plan. Things changing. The biggest change is to Part D, the medicines. So it used to be that there was a donut hole, a gap where you had to pay more for your medicines until you had spent a certain amount of money. That's gone. And now there's a cap on how much you would have to spend. So now there's a cap of you won't have to spend more than $2,000 a year on your medicines. And if you are going to spend that much, you can sign up for a program. It's called M3P. And that allows you to finance that $2,000 over 12 months.
Okay, well, how can a person get connected with you all to begin the sign-up process?
They can call us at our 888 number, and I'm sure you have that up on the screen. And so just talk to somebody. You'll get a real person, someone who's from here, who is here, and they'll help you through it. And again, like I said, make sure you have a list of your medicines, because that's going to be really important.
Perfect. Thank you so much, Carle. We appreciate you for your time, and we appreciate Carle for sponsoring our segment today. To learn more, we'll connect you with Carle and Health Alliance over at our website at ciLiving.tv.